Doctor, my child has autism. How will stem cell therapy help my child?
First, we have to understand what exactly the problem is in the brains of children with autism. Recent research, especially that done by us at NeuroGen, shows that there are specific parts of the brain, particularly those on the back and the medial parts, which are functioning less than normal. And there are other parts of the brain that are actually functioning more. Now that we have a better understanding of the biology of the brain damage of children with autism, it is possible to treat this. What we have found is that stem cell therapy helps to repair the damage that we see in the brains of children with autism, and as the functioning of the brain improves, their symptoms also improve. So stem cell therapy is the new treatment, the new weapon, the latest method that we have in the treatment of children with autism.
What are stem cells and how do they work?
Stem cells are cells which have the potential to multiply, which means if I have one stem cell, I can make 1,000,000 stem cells out of it. They also have the potential to convert. So if I take a stem cell and put in the brain, they become brain cells. If we put in the muscle, they become muscle cells. So stem cells have the potential to convert into different parts of the body. So in autism, where the damage is in the brain, we are able to go and put the stem cells into the brain, and so they help in repairing brain damage. So stem cells act in three ways. They repair, they replace, they regenerate. And through this process, as the brain functioning becomes normal, they ease the symptoms that our children suffer.
What kind of stem cells are you using?
There are different types of stem cells. You can get stem cells from the embryo. These are called embryonic stem cells. These stem cells have a lot of ethical issues about them, and they have potential medical problems, so we do not use embryonic stem cells. I want to repeat that. At NeuroGen, we do not use embryonic stem cells. The second type of stem cells which you get from the umbilical cord. The umbilical cord is the cord that connects the mother and the baby. So if the umbilical cord has been preserved at birth, it is possible to use those cells for the children. But for many children, the umbilical cord has not been preserved. So there are other stem cells in the child itself. These are called adult stem cells, and we take the stem cells from the child itself. Medically, these are called autologous, that means from the same patient. Now, in our body, in the bone, there is an excess amount of stem cells. There are millions of stem cells inside the bone in a liquid that is called bone marrow. What is bone marrow? Bone marrow is the place where our body's blood is produced. And to produce blood, the body needs stem cells. So the bone marrow is rich with stem cells. Now, if we go into the bone marrow and take the bone marrow out, we are able to separate the stem cells, which we can then use for treatment.
Is there any major surgery involved?
That is the most wonderful thing about stem cell therapy, that there is no surgery involved. There is no incision, there is not a single stitch also, there is not a single cut. The entire procedure is done through two simple injections. With one needle, we put into the bone and we take out bone marrow. And with the other, we inject into the back and into the fluid in the back called CSF. So the entire treatment has only two injections. I repeat, one to take out and with one we put back.
Is the treatment painful?
It's not painful at all. During the treatment, what we do is we give sedation to the child, so the child is actually sleeping, and then we give local anesthesia in the area around where we are going to inject, so the child feels no pain whatsoever, either during the procedure or even after the procedure.
Does the treatment have any side effects or risks or complications?
Now, one of the most wonderful things about adult stem cell therapy is that it's got no major or irreversible neurological complications, reactions, or any other side effect or risk. Because what we are doing, with one needle we put into the bone and we take out bone marrow, there can be no risk in that because it's just a needle going into bone. With the other needle, we put into the back a very thin, very fine needle into the fluid. There's no risk whatsoever. And we are using the child's own cells. We are taking from an area where there is extra and putting it in an area where there is less. So We are using the same cells. There's nothing artificial. There's nothing unnatural. There's nothing from the outside. There's no chemical, no agent, no drug. What we are doing is taking cells from the child from one area and putting it in another through 2 needle pricks. So it's completely safe, and you have my personal assurance on that. We have done now over 5,000 patients of stem cell therapy, and we've not had any major irreversible neurological complication or deterioration. So you can be completely rest assured that this is a completely safe treatment.
What examinations and investigations are to be performed before the therapy?
So it is very important for us to understand exactly the amount of damage, if there is any, in the brain. For this, the most important test is something called a PET CT scan of the brain. This is called positron emission tomography. This tells us the functioning of the brain. It tells us which parts of the brain are functioning normally, which parts are functioning less than normal, and which parts are functioning more. So PET scan is a very, very important test. In addition, we have to do an MRI scan of the brain, which helps us to look at the rest of the brain and rule out any other major problems in the child's brain. We also do an EEG. An EEG is a wave study, much like the ECG for the heart. You must be familiar. I'm sure you've had an EEG done for your child earlier. And this combination of a PET scan, MRI and EEG tells us exactly what the child's brain's condition is today. In addition to this, we have to do some simple blood tests, like hemoglobin and creatinine, etc., which just tells us that the child has no infection and no major medical condition, which is a contraindication.
How long do we have to stay in the hospital?
You have to stay in the hospital for a period of 1 week. Our admission is normally on a Sunday, and you have to stay the whole week, and we discharge the patients on Saturday. So it's a 7-day stay.
If we go for the treatment, are there any chances of the patient getting in a worse condition?
Absolutely none. Like I reassured you earlier, this is a completely safe treatment because it's minimally invasive. That means there's no cut, no stitch. We are just putting 1 needle into the bone, taking out bone marrow, 1 needle into the back and injecting cells and injecting the child's own cells from one place to another without manipulating them, without changing them in any way. So the treatment is completely safe.
What exactly happens in the 7 days of the treatment?
So after the admission on Sunday, day 1, which is Monday, is a day of investigations and evaluation. So the child will be evaluated by various different departments, the occupational therapy department, the psychology department, the physiotherapy department, etc. We also have a whole series of tests, like we do a PET scan of the brain, we do an MRI of the brain, we do EEG, and we also do some blood tests. So Monday, there is a detailed clinical and investigative evaluation. The second day on Tuesday is the actual stem cell day, where the child is called in the morning and is given sedation. So the child is sleeping on the operation table. We then give local anesthesia in the area just above the hip called the pelvis, and then into this bone we inject the needle and we extract the bone marrow. This whole process takes about 20 minutes. After the process is over, we send the child back to the room. Then over the next 4 to 5 hours, from the bone marrow which we have taken from the child, we separate the stem cells. It's a pure process of purification, filtration and separation. No chemicals or agents or animal proteins are added. We just separate the stem cells gently from the remaining cells. The remaining cells are thrown away, and the pure stem cells, once they are ready, we call the patient back to the operation table, and there a thin needle is inserted into the lower back. This is called a lumbar puncture. We put this needle into the fluid. This fluid is referred to as CSF or cerebrospinal fluid, and we inject the stem cells into the cerebrospinal fluid. Now you may ask, why are we injecting into the cerebrospinal fluid? Because the cerebrospinal fluid, which is in the lower spine, it flows all the way up to the brain, and when it goes to the brain, there the damaged areas sort of pull the stem cells towards them. So we don't have to go into the brain. We want the stem cells to go to the brain, but we don't have to open the skull. Through a small needle in the back we inject, and then this goes all the way up to the brain. This lumbar puncture procedure also takes about 20 minutes, after which the child goes back to the room and just has to rest. In about 2 or 3 hours can take liquids, water, oral feeds, etc. And only for that evening and night the child has to rest. From the next day, from Wednesday to Saturday, there is a very intensive process of rehabilitation, we have various aspects of rehabilitation. In autism, these include occupational therapy, it includes sensory integration, psychological evaluation, ABA, special education, pediatric physiotherapy, art therapy, dance therapy, music therapy, and a whole lot of other therapies which are specially tailor-made for your child and based on the problems and symptoms that he has. And on Saturday, you are discharged, where you are given a detailed note on everything that was done in this 1 week, as well as everything that you need to do for the next 3 to 6 months.
How long will it take us to know that the patient has benefited from the treatment?
The real improvements we actually see after 3 months. Immediately after the treatment, over the next few days or weeks, we will start seeing minor improvements. But at 3 months, we start seeing the major improvements. And between 3 to 6 months, the changes are almost transformational. The hyperactivity almost completely disappears. We find behavioral issues get resolved. Speech is the last thing to come, which comes a little later. But all the symptoms gradually start improving. The report from the schools of these children say that the teachers say that the child is much better managed in the school, the child's performance in the school improves. The therapists who are treating the patient say the child is much more responsive and that they are able to get better results from the same therapy earlier where they were having difficulties in getting results. So there is an overall improvement in all aspects of the functioning of the child.
How important is rehabilitation after stem cell therapy?
Rehabilitation is extremely important because when we put the stem cells in, it is very important that the rehabilitation complements the stem cell therapy. It is together that we get the results. Our stem cells that we put inside will help the low functioning brain to improve its functioning. It will help to repair the damage in the brain. But this brain which has now been damaged needs to be programmed, needs to be taught what to do, and this happens only through rehabilitation. So we believe that stem cell therapy and rehabilitation go completely hand in hand. They are like a sync, and together they produce the transformational results that we have seen that they produce.
When do we have to do a follow-up again after stem cell therapy?
It is important to follow up with us 6 months after the treatment, because at 6 months we like to do a clinical evaluation to study what improvements have happened, and we also repeat the PET scan of the brain, and the PET scan of the brain then tells us how much of the damage has actually been repaired due to the stem cells. So the 6-month follow-up after treatment is extremely important.
What do we have to do once we reach home after discharge?
When you are with us for 7 days, your child will be undergoing all the kinds of rehabilitation that we have to offer at our institute. Now, when you are here, we will also be teaching you how to do rehabilitation at home. So you can continue many of these rehabilitation at home. We also video record the entire rehabilitation process and give it to you on a pen drive, so that when you go home, you can watch and see and refresh your memory as to what rehabilitation has to be done. Now, you will continue whatever rehabilitation is going on, whatever occupational therapy, whatever ABA, whatever else you are doing, that has to continue. But you also at home will have to continue some of the therapies which we will be teaching you and training you how to do at home.
If we have any problem related to admission, whom should we contact?
Now, the moment you come to us, we appoint a coordinator for you. There will be one person who will be your complete support and assistance from now till the process you come into the hospital. And your coordinator will guide you step by step what to do. And if you have any difficulties or any questions, your coordinator will address all of them.
If we have any problem after discharge, whom should we contact?
Now, once you come to us during your admission process, you are appointed a case manager. A case manager is a therapist, could be an occupational therapist, a psychologist or a physiotherapist, but is a clinical person who will actually be responsible for you in every way. And after discharge, your case manager is the one who will continue to be in touch with you, who will follow up with you. And if you have any problem, any query, okay, you can always reach your case manager at any time. Also, we have a 24/7 helpline which you can reach our doctors. So if there's any medical query at any time of the day and night, you can reach our doctors and you will get help and your problems will be addressed.
Why hasn't our doctor advised us this treatment?
Stem cell therapy is a new form of therapy. It's not available in all the hospitals and institutes, and so its awareness is limited even amongst the medical profession. So there are some doctors who may know about stem cell therapy, there are doctors who may not know about stem cell therapy, there are doctors who know about stem cell therapy but are not sure that it works. So it's a combination of factors. Because it is new, that's the reason why a doctor may not have advised it to you.
Do you give any medications after the treatment?
There will be some supportive medications that are given for a couple of days and weeks, but these are very small and few, and no major drug is required after stem cell therapy.
According to you, should we proceed with stem cell therapy for our child?
I personally feel that we should definitely offer stem cell therapy to your child for the following reasons. Number one, we don't have any other option. There is no medicine, no drug, no surgical intervention which will go down to the brain and repair the damage in the brain the way stem cell therapy does. Secondly, stem cell therapy, the way we do it using adult stem cells, is minimally invasive. The child gets only 2 needle pricks. So it's completely safe. There's no risk of any deterioration or major side effects or complications. So safety is assured and guaranteed, and they are definite improvements. And these improvements you can't see with any other form of treatment. In addition, all our work is published in major scientific papers and journals, and we've got at present over 9 papers in various international journals that document the safety and efficacy of our treatment. I would say that offering stem cell therapy to your child would definitely help in his recovery from his symptoms of autism and help him to improve to the point when he can live independent and maybe a near normal life. Apart from the clinical improvement that you will visibly see as all the symptoms improve, there is also objective evidence that the brain which was damaged or low functioning has started improving. And this improvement is seen in the PET CT scans. So we do a PET CT scan before, where we see that these blue areas are areas where the brain is hypofunctioning, functioning less than normal. And you can see that in the scan done 6 months later, this area has resolved. So the blue which you see in the pre-operative PET scan, 6 months later, we can see in the scan that the damage is reduced significantly. So this is objective proof of the fact that the stem cells, having reached the brain, have helped in the process of repair, replacement and regeneration of the damaged brain, thereby helping in improvement of the child's symptoms.
What makes NeuroGen special?
What makes NeuroGen unique and special is the fact that we combine stem cell therapy, a state-of-the-art medical technology, along with rehabilitation, the time-tested method of helping these children. This combination of stem cell therapy with a holistic rehabilitation, where all the different fields of rehabilitation work together to help improve the child's functioning, this is what makes NeuroGen special. At NeuroGen, there is a significant research component to our work, and so there is a constant innovation and improvement in what we are doing. This has resulted in our producing over 71 scientific papers in various international and national medical journals. When a paper is published in an international journal, it is called peer-reviewed, which means somebody outside of us has studied our data and considers it worthy of publication. So this is very important, that our data is all in the public domain and has been peer-reviewed. We also have written 12 books. Some of these books are medical books for medical doctors. There are other books which are written for patients and parents. These books are books that help us in understanding the problems of the disease, as well as in understanding the different aspects of rehabilitation as well as stem cell therapy. NeuroGen is located in the beautiful scenic suburb of Navi Mumbai. Its sea-facing locations and the lovely views of the ocean from the higher floors make the stay very, very pleasant. Also, in one institute, in one building, we have all the different forms of rehabilitation, from physiotherapy and occupational therapy, psychological therapy, special pediatric rehabilitation, aquatic therapy, special education. various specialized fields like art, music and dance therapy. All these therapies are available in one location, and the rehabilitation is tailor-made for the individual child or for the individual patient. We also help in training. So we have people from all over the country coming to train with us, as well as teams coming from overseas countries where they come to learn about our rehabilitation techniques as well as know about our stem cell therapy. At NeuroGen, we have a combination of very senior, experienced, qualified heads of departments, and working with them are a younger team of therapists, doctors and researchers. This combination of senior experience and wisdom with the energy and enthusiasm of the younger therapist results in our patients and our children getting the best possible treatments available anywhere in the country, or in fact anywhere in the world. At NeuroGen, excellence in quality has always been our major focus, and this importance that we give to quality has resulted in various accreditations such as the ISO. Also, our stem cell laboratory has both GLP certification, which is good laboratory practices, as well as GMP certification, which is good manufacturing practices. We also have various other national as well as international certifications and accreditations. But the important focus is our patients should get the best possible quality treatments available anywhere in the world. So to all you parents who have been told repeatedly by all your doctors and other medical personnel that nothing can be done for your child, I want you to know that that is no longer true. Today, medical science, medical research and medical technology is here to help your child. The brain damage that your child has due to autism is correctable. It is treatable. And this treatment that is available is a very simple, minimally invasive, 100% safe and a very effective treatment. It is very important that we change our thinking. We have been told so often that nothing can be done. So inside of us, we give up hope sometimes. It is very, very important that we do not give up hope, because once we give up hope, there is nothing else available for our children. There was a time when nothing was available, but that's not true anymore. All right? So if we look at autism as a problem to be fixed, just like if our child had a fracture of the leg, what would we do? We would go to an orthopedic surgeon and get the bone fixed. There is nothing wrong with your child. The only problem is there is a small part of the brain that's not functioning 100%, that's functioning less than 100%. Earlier there was no treatment for it, now there is a treatment for it. With stem cell therapy, we can improve that functioning. So if we just look at autism as a problem to be fixed and fix the problem, we can help our children to lead independent and near normal lives. We have treated over 5,000 patients from more than 50 different countries, from all the 6 continents of the planet. So people from all over the world, parents from all over the world are coming to NeuroGen to take this treatment, which is simple, which is safe and which is effective.